Hello, fellow hospitalists, and welcome to Documentation Talks with Dr. Tom. As always, our purpose is to help you get credit for the great work you are doing, and also to help you avoid queries. In other words, we want to help you document like a genius. Today's topic is heart failure. With the new heart failure treatment guidelines that came out in circulation earlier this year, some of the nomenclature has changed. However, complete and accurate documentation for heart failure remains simple and requires only two elements: acuity and type. Let's start with acuity. Acuity is classified by either acute or chronic or acute on chronic. It can also be classified as decompensated, which really is the same thing as acute on chronic. However, you need to be aware of the term exacerbation unless you further classify it. Unless you do, this may result in a query. Type is also easy to document, and this is where the new treatment guidelines that came out earlier this year come into play. As you know, heart failure is now classified three ways: heart failure with reduced ejection fraction, heart failure with minimally reduced ejection fraction, and heart failure with preserved ejection fraction. However, in the coding and documentation world, we recognize the traditional classifications of systolic and diastolic. So for systolic heart failure, acceptable terms are systolic, heart failure with reduced ejection fraction, heart failure with minimally reduced ejection fraction, or mixed systolic and diastolic. For diastolic heart failure, acceptable terms are diastolic, heart failure with preserved ejection fraction, or heart failure with recovered ejection fraction. One important thing to keep in mind is the coders will recognize in your documentation the initials HF, PEF for preserved and HF, REF for reduced. So an example of complete and accurate documentation for heart failure is acute on chronic heart failure with a reduced ejection fraction. It's that simple. Now for a quick note on right-sided heart failure. The key to correct documentation on right-sided heart failure is to tie it to an etiology. And as all of you know, the most common etiology is left-sided heart failure. So as long as you tie the right-sided heart failure to the left-sided heart failure and classify the left-sided heart failure with an acuity and a type, you should avoid a query. But if the right-sided heart failure has a different etiology, such as a right ventricular infarct or such as a massive PE, just tie it to that etiology, and likewise, you'll be in good shape. Now for a quick recap. Complete and accurate documentation for heart failure only requires two elements: acuity and type. And keep in mind that the initials HFPEF and HFREF count and will be recognized by the coders and count in your documentation. So long, hospitalists. Thanks for listening, and stay tuned. Over the next 3 months, we will be providing some documentation tips on sepsis.